So, I'm Dr. Swapnil. We'll be covering preoperative markings and the formula in this. So, coming to preoperative markings, you have multiple methods of doing the preoperative markings. One is, so you have basically taken care of, you understood what is astigmatism and what is the different type of astigmatism that you are supposed or you will be planning to correct. Then intraoperatively, preoperatively, you have to mark the patient before, if you are not using any automated machine, then you have to mark the patient. And in preoperative markings, you have multiple methods. You can use freehand marking, you can use slit lamp assisted marking, you can use smartphone based things, as well as a new thing which has been devised by one of our ophthalmologists, which is called as STORM. So freehand marking, you can mark anywhere. This is basically a shoot first and ask later approach. Mark anywhere, take the patient to the slit lamp and find out where your marking has been done, and then intraoperatively take your Mendez ring and put it across there, and from there you recursively calculate where your toric IOL is supposed to go. Second is slit lamp assisted marking. This is a marking which you want to do when you want to mark everything preoperatively, where your incision is supposed to go, where your toric IOL is supposed to go. So in this you can use our normal slit lamp at a very thin long slit. The slit should be bisecting the cornea and it should be going through the Purkinje image, first Purkinje image, for it to be kind of useful. And what you can do is use a small 30 gauge or 26 gauge needle to create a small epithelial defect where your slit lamp marking is going, where your slit lamp light is going. You can create a very small thin epithelial defect there, and later on you can use your normal marker pen to kind of mark the slit, so mark the scratch. So that will give you a very good retained marking, and it's a very thin marking, so it will not really cause any problems intraoperatively. Another option that you can use to mark 0, 90 and 180 is air bubble marking. So in this air bubble, which is at the center of this instrument, is you have to keep it within those two lines, and that ensures that you are at 0, 180. But the problem with this method is it is a highly operator dependent method. Similarly, pendulum marking is there, in which the pendulum is supposed to keep the marker properly horizontally aligned. The only issue is you have to make sure that the pendulum is not touching the cheek of the patient. Dr. Akahushi has developed his own Axis one-step electronic toric marking device. In this, basically what it does, it gives you a visual clue. So this is a simple device in which the patient is sitting upright before the surgery, and you have to turn the dial towards the proper marking that you want to make. Once that is done, this light in the center will turn green or red, green, orange, red, depending on how much your hand is tilted from 0, 180. So once you are at 0, 180, the light will be green and it will beep the least. In orange it will beep little more, and in red it will beep even more than that. And this can be calibrated to 0.2 degrees. So it is a extremely accurate device which is again available. STORM is a invention by one of our own ophthalmologists in India. It's a slit lamp based marking device. It's a marker which is fitted in the calibration slot of our slit lamp, and it basically minimizes the operator related errors, operator movement related errors that can creep in when you are doing a bubble marking or when you are doing any of the other markings. And the accuracy is up to 2.4 degrees plus minus 1.96 degrees. It's a very simple and convenient device to be used. Smartphone, we have iToric Patwardhan. We are launching a new device in the market very soon that is going to be called Precision Anywhere. So we'll be covering that in the talk number 5, since that is covered with there. Coming to formulae, Barrett's formula is the one which is most commonly used. It's a formula which is based on Gaussian principle of ray tracing, and the ELP prediction is based on a theoretical model. It accounts for changes in the principal plane with different IOL powers, different IOL types in terms of biconvex or meniscus, and also any change in the vergence. And it requires no special constants or modification to the formula depending on what type of IOL you are using. there are 4 types of Barretts which are available: Barrett toric, Barrett Truquet, and Barrett Truquet toric are the most important when it comes to our talk right now. Dr. Bhageshi will be covering that. And then you have another formula which is very accurate, which is called as a Kane formula. It is an AI plus theoretical calculation formula. It has non-toric, toric and keratoconus variations, and it also gives comparable accuracy as compared to Barrett. But the main problem with Kane formula is it doesn't come integrated into many machines, many optical biometers, while Barrett is now almost standard in all the optical biometers